All right, this is the integrated physical. My name's Allie. I'm going to be doing your assessment today. This is going to take, it could take up to an hour. Do you need to use the bathroom before we get started?
Nope.
Okay. Can you tell me your name
Cole,
and your birthday?
9/2 of 99.
Okay, and where are we today?
My house,
And do you know what year it is?
2025.
Perfect. So the patient is alert and oriented, ×3, and general survey appears to be well nourished and in good hygiene and appropriate for the situation. Behavior is appropriate. He's sitting erect, ready to be assessed. So we're going to start with the head, inspecting the head. We're going to palpate the scalp and assess the hair. There's no obvious deformities. The hair is clean and symmetrical. So then moving down to the external eye, have you close your eyes. So looking at the eyelid, they cover the eye completely. They're smooth and symmetric. The lashes are full and extend upward from the lid. You can go ahead and open your eyes. The sclera is white, and I'm gonna pull down a little bit and look at the inside of your eye. The conjunctiva is pink. Next, we are going to look at the pupils. So I'm gonna shine light here. The pupils look to be 3 millimeters, equal and bilateral. So I'm going to shine this light here in your eye. Just look straight ahead. They are round and reactive to light. So I'm going to have you look at the tip of my finger and then look at the wall behind me. And look at my finger. And they are accommodating. I'm going to have you hold this chart about a foot away from your face, cover one eye, and read the smallest line.
LTFPH.
Okay, now switch sides. Read the smallest line.
LTFPH.
And now with both eyes uncovered.
LTFPH.
So the left eye is 20/20, the right eye is 20/20, and both eyes are 20/20. Next, I'm gonna use my ophthalmoscope to check for the red reflex. So I'm just gonna have you look straight ahead. Red reflex is intact. Next, we are going to palpate the sinuses. So the frontal palpate above the eyebrow here. Do you feel any pain or tenderness?
No, ma'am.
And the maxillary, any pain or tenderness?
No, ma'am.
So those are good. Next, we are going to look at the nose. It looks to be symmetric and the skin is normal. We're going to have you tilt your head back. I'm going to shine a light and look inside the nares. The nares are pink and moist. Turbinates are intact and symmetrical. A little bit of hair noted. Okay. Next we're gonna do look at your ears. So I'm gonna palpate. The lobe is soft, the auricle is firm, and the tragus and pinna all look normal. Next we're gonna use the otoscope to look inside your ear. So I'm going to pull the auricle up and back. There's some cerumen present, and the tympanic membrane is pearly white and gray. Now we're gonna look at the other side. We're gonna pull up and back. And there's no cerumen on this side. The tympanic membrane is pearly white and gray. Next, we're gonna perform the whisper test. So I'm gonna have you cover your ear, and I'm gonna whisper 3 words, and I want you to repeat them. Shoe, door, chair.
Shoe, door, chair.
And then we're gonna do the same on this side. Hanger, coat, shirt.
Hanger, coat, shirt.
Okay. Next, we're gonna look at the mouth. Get my pen light. The lips look smooth and symmetrical. No dryness noted. I'm gonna have you open your mouth. The teeth are white. Mucous membranes are pink and moist. Hard and soft palate are intact. Tongue is rough and pink. Stick your tongue out towards me. Say ah.
Ah.
Uvula moves upward when the patient says ah. Tonsils are a 1+. Perfect, you can close. Next we're going to look at the neck. So I'm going to feel for the carotid. And that's a 2+ amplitude. And a 2+ amplitude. We're going to listen for any bruise. No bruise. Okay, next I'm going to have you tilt your head back. I'm going to palpate your trachea. Trachea is symmetric and there is no deviation. I'm going to have you swallow. We're going to palpate the thyroid. That is palpable and normal. Next, we're going to listen to the, actually I'm going to palpate for the lymph nodes next. So I'm going to feel around for the lymph nodes on your head and neck. Just let me know if anything feels tender or painful. Okay. So we have preauricular, postauricular, occipital, posterior cervical, deep cervical, superficial, and tonsillar, submandibular, and submental. I'm gonna have you shrug your shoulders, and we're gonna feel for the supraclavicular. Any tenderness?
Nope.
They were not palpable. So now we're gonna have you put your arms out like this, and we're going to assess your upper extremities. So the skin is normal and appropriate color, and I'm going to palpate the brachial pulses, and those are 2+ amplitude, and then the radial pulses are 2+ amplitude. And I'm going to look at your hands. The nails are 160 degrees, and we're going to test your capillary refill. And the capillary refill is less than 30 seconds on all the nails. Now I want you to stand up. I'm going to have you sit backwards on this chair, if you can. And we're going to look at your posterior
Your
chest.
Computer went off.
So I'm going to feel for rise and fall, so just breathe in and breathe out. And that is symmetrical. AP diameter is 1 to 2. And then we're going to do percussion, so I'm going to stick my fingers on your skin and hit it like that. Okay? Okay, and lungs were resonant. Now we're going to auscultate. I'm just going to have you take a deep breath in and out. Again. 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 And one more. Alright, lung sounds are clear and equal bilaterally. I'm going to turn back around. We're going to listen to the front. A deep breath. Good. Good. And lung sounds are clear and equal bilaterally. The chest skin appears to be normal. There's no bruising or lesions present. And now we're going to move on to the heart sounds. So I'm going to kind of feel your chest here. There's no heaves, thrills, or abnormal movement. So we're going to listen to the PMI. Just listen. Alright, then we have the aortic heart sound, which is the second intercostal space on the right sternal border. Then the pulmonic, which is the second intercostal space on the left sternal border. Herbs, third left intercostal space, sternal border. Tricuspid, fourth left intercostal space, sternal border. And then the mitral, which is the fifth left intercostal space, mid-clavicular. We're going to listen to the apical pulse for 1 minute. listen to each spot with the bell. Normal S1 and S2 sounds, no. Abnormal heart sounds. And now we're going to look at the abdomen. So normally I would have you lay down with your legs bent, but we'll just stay sitting here. So I'm going to take a look, and we would cover you with a sheet for privacy. First, we're just looking at the skin. Skin appears to be normal. There is some scars noted from a previous surgery. We're going to auscultate all 4 quadrants. The bell sounds present in all 4 quadrants. Next, we're going to percuss. So same as before, we'll put my fingers and tap them just like that in each quadrant. And that was tympanic in all 4 quadrants. Next, we're going to palpate. So we're going to start with light palpation. So I'll just push a little bit, and then deep palpation, I'll push a little bit harder. Let me know if you have any tenderness or pain. Ooh, I'm going to start the right costal margin, palpate for the liver. There's no deformities or masses noted. And then deep. We check for rebound tenderness in the right lower quadrant. It's not present. And palpate for the aortic pulse. And then auscultate. Auscultate renal. And then we would palpate the femoral, so it's going to feel 2+, and +. And go right back up. Oh, we forgot to check for hernia. So have you lean back a little bit like you were, and then lift your head up. And there's no hernia or diastasis recti. Perfect. Okay, next we're going to look at the lower extremities. So I gotta take your socks off again. We look at the skin, and the color is normal. The hair distribution is normal. I'm gonna feel for your posterior tibial pulse, and then the
Your computer's about to shut off.
dorsalis pedis. It's still recording. those are 2+, and then pedal is 2+. We're gonna feel for any edema. There's no edema noted. Okay. Also no varicosities that we can see. Okay. At this point, we would talk about examining the genitalia. So you would perform a testicular self-examination every month. You can do that in the shower or in front of the mirror, and you're just feeling around the testicles for any masses or tenderness, and then we would palpate the penis for any mass or tenderness, as well as the scrotum and the vas deferens and epididymis. For breast evaluation, we would have the patient lay flat with their arms above her head and a pillow under the scapula, and feel around the breast for any mass or tenderness. And then breast self-examination monthly after periods, and those can also be done in front of the mirror and in the shower.